Dear friends, I am Dr. Rajiv Khanna, a cardiologist, and today I'll be speaking on hypertension and what exactly is mean by hypertension and what is its implications and what are the basic ways and means where we can alleviate to let it develop in a society. We all know that hypertension is one of the commonest lifestyle diseases apart from diabetes, and moreover, it, many of the individuals, they are not even aware of that they are having hypertension. To know hypertension, we have to understand what exactly is blood pressure. Our heart normally pumps blood. There is a systolic and a diastolic segments to this contraction. The pressure caused by this flow of blood over the walls of the vessel, the aorta, is called as blood pressure. This blood pressure over the period of 24 hours goes up and down, but sometimes it is between a range which is called as normal blood pressure. If it is between the normal, then this is a normal phenomena for an individual. But if there is a persistent rise in this blood pressure, this is called as hypertension. Hypertension are normally of two types. One is the primary hypertension, another is secondary hypertension. Primary hypertension is the one where we do not have a known cause of blood pressure rise, and secondary hypertension are the one where we have a known reason like renal disease, like thyrotoxicosis, like AV malformation and other diseases. Today we will focus on primary hypertension and we will see that how does it affect the life of an individual. There are certain factors which are also affecting the rise of blood pressure, which we call as hypertension, and these factors, as one of them important, is age, smoking, family history, people who have a mother and father or second generation parents, grandfather, brother of grandfather. If they are hypertensive, there is quite likely that this person might also be harboring in coming days and will become hypertensive. Then increased sodium intake and less potassium intake is also one of the very, very important causes. Then eating processed food, trans fats, saturated fats, they are also very, very important to be causing hypertension. Then the stress level, lack of physical activity, anxiety, these all are one of the very few reasons where the blood pressure can go up. So moving on to hypertension without any obvious sign and symptoms, this is called as primary hypertension, and this is a silent killer along with diabetes mellitus. Hence, an accurate diagnosis within a reasonable time is very, very important for the morbidity and mortality and the cardiovascular, renal, as well as metabolic diseases of the body. So, the only way to know whether this patient is hypertensive or not, we have to do a blood pressure monitoring by a tool which is called as sphygmomanometer. Nowadays, we are focusing on office blood pressure, house blood pressure. We talk of white coat effect, where the person goes to the doctor and is noted for hypertension, but once he is sitting or in his house and relaxed, he is not a hypertension. This is called a white coat effect. Then ambulatory blood pressure monitoring for 24 hours is also very, very important. So, generally when the symptom occurs, they include like lightheadedness, buzzing of ear, occipital headache, especially in the early part of the morning, breathlessness on exertion on a long-standing basis, and fatigue, nausea, vomiting. And these patients, some of these patients may develop some of the symptoms, not all symptoms occur in every patient, but these are the common symptoms which are found in a hypertensive patient. Fortunately, because of the sphygmomanometer, we can diagnose hypertension quite easily, even in your own house. At least you can suspect of this. So, a healthy and normal blood pressure. To know hypertension, we should know the healthy digit. And numerically, it is said to be 120 by 80 is said to be a normal, but this is not one reading which is normal. There are range to call somebody hypertensive by the American College of Cardiology and ADA. They have given in the JNC 8 recommendation, it is 140 by 90 and above. These patients are called as hypertensive, and some pharmacological and lifestyle modifications should be done if somebody is having a blood pressure of more than 140 by 90. The Spring trial has said that people who are having comorbidities, this level should not exceed 130 by 80. So, in a different clinical situation, the hypertension definition changes. It is 140 by 90 for a common man, but with comorbidities is 130 by 80, and it should be treated. So, if the blood pressure level is more than 140 by 90, then the patient is hypertension, and with this, the risk of having cardiovascular morbidity and mortality starts occurring. The risk can be prevented by regular exercise, diet, healthy diet, as I have told you, less of salt, more of potassium, less of trans, small frequent meals, and a healthy exercise. If you are a smoker or a tobacco chewer, it is a very strong vasoconstrictor and is one of the very, very important reasons of having hypertension. So quit smoking. Then a regular blood pressure monitoring at your place in your own home, and that which is called as self-monitoring of blood pressure, SMBP, which is very, very important these days. And this will not only will make a diagnosis, but it will also empower a person to diagnose hypertension at an early stage. Then stress management and adherence to a specific medicine needs to be done. So, with regular exercise and physical activity, it can be a drug-free approach to lower the blood pressure. Regular morning walk, pranayama, yoga, and will make a person's heart stronger. And if it is there, it can pump more blood with less effort. In other case, we are also aware that age and obesity, these are also two factors which govern the morbidity and mortality in hypertensive patients. So, as the age advances, you should be more aware of hypertension, and obesity, the BMI should be kept below 25. And at a desirable level, the blood pressure should be less than 120. Then the healthy diet, a lot of fruits, 20 to 30% should be protein, 40% should be carbohydrate, and rest should be fat. The sodium should not be more than 4 to 5 grams per day, and lot of potassium should be there in the diet. Then whole grain is recommended for lowering the blood pressure and hypertension, and dietary intervention can be adopted by a diet which is called as DASH diet or a Mediterranean diet, which I have already described. What is DASH diet? It is rich in whole grain, fruits, vegetables, low fat dairy products, and skipped on saturated fat and cholesterol containing food, which can have blood pressure. So, decrease sodium in your diet. And what we have found is that the DASH diet, if taken persistently, can lower up to 11 millimeter of mercury, which is a robust number. So, this is very, very important. A Mediterranean diet which contains less of dairy products, more of whole grains mixed. Then, reduce your sodium. And you should also read the food levels, choose sodium, and try not to take fizzy drinks or beverages like Coke or Pepsi or etc. etc. Then processed food should be eaten in lesser quantity. Don't add salt. Normally we are in habit, whenever we eat like a guava or we eat salads, what we do is we sprinkle the salt over the this is a very bad habit. So you should be aware of this and should try to avoid it. Smoking, quit smoking is by your own efforts. If not, then you can take medical help to quit smoking. But smoking is very, very important. Regular blood pressure monitoring is very, very important, and it should be done so that many a times you may have a normal blood pressure at times and hypertension some time of the day. So take blood pressure at a different time on different days so that you can catch a higher level of blood pressure if it is there, and should try to prevent it by lifestyle modification. And if not, even then it is not controlled, then you can take medicine. Stress management by morning walk, exercise, yoga, shavasana. These all are techniques for the stress management. Then adherence to medicine is very, very important. We all know that several group of drugs like ARV, ACE, then calcium channel blockers, beta blockers, diuretics, and then central acting drugs, then drugs for the resistant hypertension. So these drugs are very, very important, and they have a very particular time period in which they work. So the timing of the drug, like the chronobiology has proven that giving ACE and ARV at the bedtime is the best time. If a young individual with a high adrenergic activity, beta blocker is very good. In an older age group, it is the calcium channel blocker, which is very, very important. And so these are the drugs which you should not do self-medication, but you should regularly see your physician, your cardiologist, and try to take a very legitimate prescription, but at a very same time. So, a medicine to lower the blood pressure should be recommended if the blood pressure is above 140 by 80, and it should be measured. So, at last, I would recommend that hypertension is a very, very, very prevalent disease. It is common with even nowadays because of the stress levels in a younger age group. Do not neglect them. Do not neglect your readings. You have to find out whether and if the patient is having blood pressure which is labile in nature. You can go for an ambulatory blood pressure. Morning dippers, non-dippers should be recognized to see that these patients are prone for stroke. The lifestyle modifications are very, very important for this. So many a time, you will be able to prevent a particular and save the patient from cardiovascular morbidity and mortality. Thank you very much.